As you know, I had the opportunity to meet with Prime Minister Carney last week and discuss the circumstances facing our country, especially in advance of an important budget that we all know is going to be announced on November 4th. It was an opportunity for me to lay out our perspective as New Democrats on where we think our economy is and what we think is needed at this point in time. First and foremost, I expressed to the Prime Minister that as a strong New Democrat opposition, we are going to be supporting policies that we agree with, and we will be opposing policies that we don't, and therefore we will wait until that budget comes out and we'll evaluate the budget based on what is contained in it. At the same time, we communicated very clearly that we would not be able to support a budget that takes an austerity approach. In our opinion, at this moment in time when we are facing serious economic headwinds and challenges from south of the border, that an economically contractionist approach to our economy is not what's called for, but rather we need to be investing. We need to be investing in Canadian communities, Canadian businesses, Canadian workers, and Canadian infrastructure. I also took the opportunity to highlight a number of areas that we would like to see included in the budget, which is substantial investment in jobs, housing, and healthcare. And by jobs, we mean investing in those kind of jobs that are family sustaining, preferably unionized in every corner of the country. When it comes to housing, we want a serious investment from the federal government in affordable, non-market housing, because we know that's what anchors people in their communities and makes their ability to participate in our economy possible. And finally, in terms of healthcare, we don't believe that you can have a strong economy unless you have a healthy workforce and a healthy population. And, you know, even though it's not been talked about recently, we still have serious crises in our healthcare system. Millions of Canadians cannot access a family doctor. We have significant burnout, retention and recruitment problems in our healthcare workforce, and too many people can't get timely access to the care that they need. So broadly speaking, those were the projects and the principles that I outlined to the Prime Minister, and I'm happy to take your questions.